Most people I meet aren't using all their Medicare benefits or are not fully aware of all the benefits from Medicare that are available to them.
Did I miss something?
And you might be one of those people that's not using Medicare to its full potential. Because aside from the usual doctor's visits and hospital stays, there are a bunch of other services that Medicare covers. And so many people today don't take advantage of these. Or maybe they have no idea that Medicare even covers these services in the first place. That's why in this video, I'm going to count down the top 7 surprising things that Medicare does cover in 2025. Starting with number 1, chiropractic and acupuncture services. This one might be surprising because a lot of people have this idea that Medicare only covers, traditional medicine. However, a lot of people say that chiropractic services help them to overcome pain and get off pain relievers, reduce the symptoms of osteoarthritis or scoliosis and headaches, and even help improve their posture. I feel like I need to sit up straight now. While many people who get acupuncture say that it can relieve stress, headaches, anxiety, insomnia, and depression, and even helps them with nausea or vomiting. So chiropractic and acupuncture services have proven to have health benefits for a lot of people. However, for both chiropractic services and acupuncture, you can't just go whenever you have a backache or feel stressed. Medicare only covers chiropractic services for manipulation of the spine or to correct subluxation, which is a fancy way of saying that the joints in your spine aren't moving properly, but they're still in contact with each other. So think of this as very traditional chiropractic services for manipulation of the spine. Now for acupuncture, Medicare will cover acupuncture for chronic low back pain, which typically means that you've had back pain for more than 12 months or longer without an identifiable cause, and it cannot be related to pregnancy or surgery. And you might laugh to yourself and say, pregnancy with Medicare, what's that all about? But remember that some people have Medicare through disability or under the age of 65. So for acupuncture, Medicare will cover up to 12 visits within 90 days and up to 8 visits more if you're showing signs of improvement. Another thing that Medicare beneficiaries often don't realize is that Medicare covers a lot of preventative services. As you can see here, there are so many of these preventative services, and a lot of these services are covered 100% by Medicare. For example, Medicare covers cardiovascular disease screenings, which includes blood tests for cholesterol, lipid, and triglyceride levels. All of these tests can help doctors tell if you're at risk for a heart attack or stroke. Another thing is if your doctor says you are at risk for diabetes, Medicare will cover 2 blood surgery laboratory tests to help see what's going on there. Or even if you're just overweight or your family has a history of diabetes, Medicare should cover diabetes screenings at no cost to you. There are also screenings for different types of cancers like lung cancer, prostate and cervical cancers, mammograms, and many more. Now, each service is on its own terms, so if you want to learn more about what exactly Medicare covers, I highly recommend checking out the 2025 Medicare and You Handbook, which you can download for free on Medicare's website, and I'll leave a link in the description below. At number 3, we have something for people who are struggling with either an alcohol or smoking addiction. Now, we all know that alcohol and smoking can put you at risk for a lot of medical conditions, and there are so many studies that show that alcohol abuse leads to cancer, liver and heart disease, stroke, and even brain damage. The same goes for smoking, and you probably don't need me telling you that smoking is bad for your lungs. That's why Medicare is trying to fight these diseases and conditions at the source. They're trying to help to prevent you from getting these diseases and conditions before it occurs or before it's too late. So if your primary care doctor determines that you are misusing alcohol, Medicare will cover up to 4 face-to-face counseling sessions per year, and you shouldn't have to pay anything for these sessions. For tobacco use, Medicare covers up to 8 counseling sessions per year, and once again, you shouldn't have to pay anything as long as your doctor can bill Medicare. At number 4, we have Hospice Care. This one is a bit surprising since most of what Medicare covers are preventive services and treatments. However, if you are terminally ill and you decide to focus on comfort and quality of life rather than continuing treatments to attempt to cure your illness, Medicare will cover a bunch of hospice care services. Now, God forbid this happens to you, but if you find yourself in this type of situation, it's nice to know that the bulk of the cost will go to Medicare rather than to your loved ones. Medicare should cover items and services like drugs, durable medical equipment, and things for pain relief and symptom management. They also cover medical, nursing, and social services, an aid, and even things like spiritual and grief counseling. However, despite all of this, it's very important to note that Medicare does not cover long-term care. Hospice care and long-term care are not the same thing, and Medicare will not cover your room and board in a long-term care facility, so keep that in mind. Now, before I get to the last 3 surprising things that Medicare does cover, let me just jump in here and say that if you're finding this video helpful, please hit the like button, and be sure to subscribe for more helpful Medicare videos like this one. Now at number 5, we have something that's new for 2025. Starting in 2025, Medicare will now cover caregiver training resources. This is exciting because for the longest time, finding a good caregiver was a challenge for a lot of people. And a lot of people turn to hiring professional caregivers, which can be expensive. Or they've settled for someone that they know, but that doesn't have the skills for proper care. Well, starting in 2025, Medicare will cover training that will help your caregiver learn and develop the skills needed to care for you, such as how to administer medications, how to provide personalized care, and more. Now, keep in mind that Medicare will only cover this if your doctor or healthcare professional says that a caregiver training is appropriate for your treatment plan, and if your caregiver can get training sessions without you being present. Number 6 might be a surprise to some, but Medicare now covers mental health care. There are still some people out there who don't believe that mental health care is a real thing, but in recent years, doctors have really come to realize how vital mental health care is to your overall health, and Medicare has slowly but surely started to realize this as well. That's why Medicare now covers a healthy amount of mental health services. This includes services by marriage and family therapists, partial hospitalizations, and services like psychiatric care, counseling, and therapy. You can get these services at community mental health centers, federally qualified health centers, rural health clinics, and opioid treatment programs. Not only that, but Medicare Part A also covers inpatient mental health services that you would receive in an inpatient hospital setting. Finally, number 7, Medicare also covers your annual wellness visit. Now, this might not seem like a surprise at first, but a lot of people trip up on this because Medicare does not cover a routine physical exam. So you might be scratching your head wondering, what's the difference? Well, in a nutshell, annual wellness visits aren't quite as comprehensive as routine physical exams. However, they are still very efficient at spotting illness or conditions before they become worse. Always remember that finding a health condition early is better than finding it once it's too late. I'm sure I don't have to tell you, but finding something early can lead to better outcomes. So spotting a condition is always better to find it early than finding it late. And with Medicare, the annual wellness visit helps to do that, and you're entitled to one of these once per year at no cost to you. Also, when you first enroll in Medicare, you are eligible for a Welcome to Medicare preventative visit, also at no cost to you. And on this visit, your doctor will review your medical history and develop a health plan for you. Both of these checkups are great ways to get an idea of where your health is and what you can expect in the coming months. So take advantage of both of them because they go a long way in preventing illness and health conditions before they become worse. And that was the list of the 7 surprising things that Medicare covers in 2025. If you want a full list of what Medicare covers, I highly recommend downloading the Medicare and You Handbook for 2025. I'll put a link in the description below. Also, if you want to see 7 surprising things that Medicare does not cover, check out this video over here. Other than that, thank you for watching, and I'll see you on the next one.